This is the AFP Health Service Command, Victoria Luna Medical Center, and this is the Department of Radiological Sciences and Imaging, also known as DRSI. We are the forerunner of medical imaging in the Armed Forces of the Philippines. It is planned to acquire the top-of-the-line medical equipment, which with various excellent services has the capability to diagnose medical conditions of the persons responsible to defend our land and sovereignty. It houses 6 X-ray rooms wherein different radiographic procedures are done. Various positions are done to acquire the best views for specific parts of the body. In instances, the patient cannot tolerate standing. The patient could lay down here. This is another setup wherein the table could be moved and angulated. In conjunction with a moving X-ray tube, the patient's positioning is optimized. Images could be taken in fast sequence such that they may be viewed in real time. Fluoroscopy, as it is termed, is often used with contrast materials to better evaluate structures where it passes through. Such common procedures include barium enema, wherein barium is used to line the colon as contrast, and hysterosalpingogram, where water-soluble contrast is used to take the shape of the uterine and fallopian tube lumen. Patients not able to be transferred to the department safely may avail to the portable X-ray services. At least 3 functional portable devices are always on standby. The department always has at least 2 fully functional ultrasound machines to cater the outpatient and inpatient sonographic request. Various probes have different uses. Dedicated probes are capable of doing breast, musculoskeletal, cranial, endocavitary, and vascular ultrasound. Some of these machines may be brought out of the ultrasound room for portable sonographic evaluation if the need arises. This is the CT scan suite. The patient is scanned for a few seconds to obtain a 3D image of the scanned area, which could be sliced in multiplanar views. Techniques such as multi-phase scanning and multi-route administration of contrast adds onto its diagnostic prowess. The CT scan is capable of doing CT angiography, showing the blood vessels more clearly, and doing 3D reconstruction, mostly for surgical planning of orthopedic cases. The magnetic resonance imaging, or MRI section, has a few zones of restriction due to the fact that the strong magnet within the machine may cause harm if metals are not detected beforehand. It uses nuclear magnetic resonance in sequences of pulses to produce multiplanar images for later radiologic scrutiny. With superior quality to the CT scan for most soft tissues, it is the standard of imaging for evaluation of the joints and muscles. MR cholangiopancreatography uses techniques unseen in other modalities to evaluate the entire hepatobiliary tree without the use of contrast agents. MRI is also capable of MR angiography, providing similar, if not better, imaging of the arteries without the effects of ionizing radiation. Other services include protocols specific for the pituitary gland, prostate gland, and liver with a liver-specific contrast. The central reading room is where the magic happens. Radiology residents, under the supervision of the renowned subspecialty consultants, give the reports with utmost observation and analysis of images from corner to corner. They provide descriptions, associations, and differential diagnoses with years of excellence and practice behind them. Providing clinical answers to the requesting physicians is always the joy of clinical diagnostic radiologists. Once the patient enters the reception and information area, data will be processed and the images that will be taken will be sent to the hospital-wide picture archiving and communication system, also known as PACS. Reports are duly made in the Radiology Information System, termed RIS. The combined system of RIS PACS provides a streamlined workflow from image acquisition to viewing the images along its official result. Even though diagnosis is the principal role of radiology, a new frontier delves into directly treating patients using medical imaging. Interventional radiology, fondly termed as IR, uses specialized catheters and other equipment to do minimally invasive procedures such as percutaneous biopsies and biliary catheter placements. Currently, top-of-the-line CT scan is being installed. Faster scanning would allow better patient experience and even better image acquisition. Recent graduates are undergoing training in world-class institutions to return as consultants in subspecialty fields such as pediatric and interventional radiology. Future plans of the department include securing a novel digital mammography machine with tomographic capabilities and creating an innovative angiography suite where the potential of interventional radiology will be significantly expanded. Other plans of the department include adding workstations throughout the hospital for image viewing and allowing growth of the department to become paperless. With radiography, ultrasonography, CT and MRI imaging, DRSI is always ready to cater to your diagnostic imaging and specific therapeutic needs. The department will continue to improve and expand its services and expertise in the near and far future to include new technological advancements for broader analysis and more specialized procedures. Always moving forward, always prepared, with honor, service, and patriotism. This is the Department of Radiological Sciences and Imaging.